Hi there everybody, my name is Dr. Suneel Dhand and I am an internal medicine physician. A bit of background about me: I was born in London, grew up in the United Kingdom, went to medical school over there, then I hopped across the pond, did my residency in Baltimore, have since worked up and down the East Coast and now practice a mix of inpatient and outpatient medicine in Massachusetts. Since the beginning of this pandemic several months ago, I have had my doubts about how we've been dealing with things. I thought that everything would get better with time, but alas, I only see it getting worse. I'm not going to mince words here. I think that segments of the medical community and indeed the whole world leadership have truly lost their minds when it comes to dealing with COVID-19. We have strayed so far away from a common sense, rational, logical approach that it is staggering. Everything has also become a toxic mix of politics, of media sensationalism, and also hidden agendas from people and industries. What do we need then? Well, we need to get back on track. We need to have more common sense, logic, and a rational debate. And that is why I am launching Common Sense COVID Doctor, to present to you the facts, tell you the truth, and let you make up your minds, hopefully based on common sense. We know the risk factors for getting seriously ill from COVID-19. We need to be aggressively protecting and targeting vulnerable groups, including the elderly and those with chronic medical conditions. We need to be pushing sensible, common sense public health measures like washing our hands, like staying away from crowded spaces, especially if we have risk factors. We also need to be trying everything possible to avoid lockdowns. Lockdowns are devastating for people's physical and mental health. In fact, over the last few months, I have seen more issues due to lockdowns in my patients than patients with actual COVID-19. And of course, if you lock people away, you are going to stop the spread of infection. That's a no-brainer, but it's a very medieval way of thinking, is it not? We should have moved on from that by now. It's 2020. What else do we need? Well, we need to be keeping schools and colleges open. The effect of closing educational institutions is devastating for children and young people. We see this all around us. Finally, we need to be pushing a public health wellness message. We can absolutely be doing things to boost our own immunity, such as eating a healthy diet and exercising. These are all the topics then that I will be focusing on with Common Sense COVID Doctor.